Hi, I'm Sharon Kotsky, and I'm the president of Visum Light. And I have the pleasure today of speaking with Dr. Kevin Connors with the Connors Clinic. And we're going to talk about some of the ways that we can support people with cancer and the course that he actually has. So, Dr. Connors, I'm going to let you run with that.
Oh, well, thank you. Yeah, we do have a course based upon my book, Stop Fighting Cancer and Start Treating the Cause. I've been seeing people with a cancer diagnosis since the late 90s. I've been out of school since, let's see, I graduated in 1986. So I've been around a long time. And I wrote a book. I think I wrote the first edition back in 2010 or 12 or something like that. And I think it's on the third or fourth edition right now. Stop Fighting Cancer and Start Treating the Cause. And we've had tens of thousands, if not 100,000 downloads. It's on Amazon and available for everybody. But I thought, the last edition is up to like 600 pages. And I thought, this was about 2 years ago, we need to make a course out of this and make it more digestible for people to get this information, because sometimes some people like to read and do well with that, but as new things come out, I don't want to just keep publishing new editions. With a course, then we can make that a living course. And as new things come out, I add new videos or add new information to that course, and people can get updates. So we did that. I think we published the course maybe 2 years ago, and it continues to evolve and get bigger and bigger, and more videos and more helpful diagrams and data that people can use to help deal with a serious diagnosis like cancer.
Right. Well, I'm pleased to offer the course in conjunction with the Visum Light because you offer the Visum Light, and there's a lot of ways that the Visum Light can help um, through the course of this diagnosis. So, when you talk to people, what is there a number one thing that people have in common besides that they've gotten this diagnosis?
When somebody's got a diagnosis of cancer, you typically it's it can be tied to their environment. It can be tied to which part of that has to do with diet. Part of that has to do with exposure to chemicals. You think, well, how can a little child have cancer and have it tied to their environment? It has to tied to the mother's environment. What was she exposed to? Medicines that she may have had to take, chemicals that she was exposed to in where they live, and what she ate and drank, and those affect our cells. So when we discuss cancer, we want to make it clear that what cancer is. Cancer is your own cells. And cancer starts in one cell. Something got inside that cell and disturbed the DNA at the nucleus and the replication rate of that DNA. And now that cell is in a state of rapid replication, and it's replicating cells that are in a state of rapid replication. That's the definition of what cancer is. And that's what makes it difficult for your body to heal sometimes, because it is your own cells. And when your T cells and your natural killer cells that are supposed to destroy enemies comes up to a cancer cell, well, the cancer cell is your own cell, will disable the T cell's ability to kill it. And so the cancer can continue to grow unabated and continue to replicate. And that's where using frequencies and dietary changes, so you're not continuing to fuel the cancer, specific nutrition that can be a good, at helping kill cancer cells and stimulate your immune system. All can be good adjuncts to a person's protocol, whether they choose to do standards of care or not.
Would any of these vibrational therapies or light therapies make the cancer react in a negative way?
Well, the therapies that are typically used by practitioners, and what I recommend a lot, is the frequency medicine. So using Rife technology, using Visum light. And I am in favor of using frequencies with light because I think it has a different added benefit to people, especially with cancer. Can there be negatives to using frequencies, light frequencies with cancer? Um, the beauty of it, the easy answer is no, there's none. So there's zero contraindications, zero for cancer patients. Now I would rephrase that if we were talking about cancer. So if we're talking about a tick-borne illness like Lyme disease, yes, there can be contraindications, or we should say, um, concerns when you're using light frequencies on Lyme disease because because they work. So when you're trying to kill Lyme disease, which is Borrelia, it is a gram-negative bacteria. There's other complications. Gram-negative bacteria have lipopolysaccharides in their cell membranes. You can kill too quickly. You'll liberate a lot of lipopolysaccharides, which are called endotoxins, and you could produce what is known as a Herxheimer reaction. You could make the person ill because you're killing too quickly. Now, your own cells don't have that. So if you kill cancer cells quickly, you're not going to get a Herxheimer reaction. So that's not going to happen. So there are no contraindications with a cancer diagnosis. There are contraindications, meaning you have to go slowly with your care with a tick-borne illness or really any gram-negative bacteria that you're trying to kill. You have to go slowly with that. But with a cancer patient, there's no contraindications with using light frequencies.
And so increasing the blood flow in a patient like that is actually a good thing?
Well, let's clarify that because there's some misunderstandings about blood flow in cancer. So with what are called solid tumors, which are like a breast cancer or a bone cancer. The opposite of a solid tumor would be like a blood cancer, like a leukemia. There is no solid tumor that you're trying to deal with. So with solid tumor cancers, you do not want to increase the production of blood vessels into the tumor. So some people may, in a lay term sense, I don't want to increase the blood flow to the cancer because that will make it worse. Well, that's not a correct physiological statement. So in truth, you do want to increase the blood flow to the cancer because that's how, even if you're doing standards of care like chemotherapy, that's how chemotherapy is going to get to the cancer cell. That's how you're going to be able to oxygenate a cancer. That's how you're going to be able to get an immune response to the cancer. What you don't want to do with solid tumor cancers is increase the growth of blood vessels, of new blood vessels into the cancer itself. So that's called neovascularization. You don't want to increase new vessels growing into the cancer. And so you do want to be careful from a nutraceutical standpoint not to do that. So step back a second. Light frequencies of any source does not do that. So light frequencies with the Visum light, Rife frequencies with the Rife do not increase VEGF production. So VEGF is a chemical called vascular endothelial growth factor, which stimulates neovascularization. So it stimulates new blood vessels to grow. That's actually a positive thing for like heart disease. That's a positive thing for people who have a history of strokes. You do want neovascularization. You do want VEGF, vascular endothelial growth factor production. But with cancer, you don't. So you do, from a nutritional standpoint, a lot of nutritionists don't understand this. You would treat a heart disease patient differently, and in some cases in an opposite form than the way you treat a cancer patient. So cancer patient, you do not want to give nutrition that will stimulate VEGF production. Heart disease patient, you do want to. So what are your, just to clarify with all the listeners out there, number one, Light frequencies don't do that at all. So light frequencies aren't going to increase VEGF production for a heart patient and help a heart patient in that way. And they're not going to increase VEGF production in a cancer patient and harm a cancer patient that way. But there's nutritional supplements that do. And typically those are things that stimulate nitric oxide production. So nitric oxide is something that's used. Nitric oxide stimulators are nutritional supplements that are used a lot in the athletic community because they increase vascularization and increase flushing. It would be something that you'd give to somebody that has high blood pressure. It's something you'd give to somebody that has intermittent claudication in the heart, any type of cardiac issues. You'd give it to somebody that has a history of strokes. That would be a good supplement to use for that. And I have patients that come to me that went to a nutritionist and they're a cancer patient and they're taking that stuff, and you have to take them off of that stuff because the nutritionist was ignorant about that.
So to clarify, if somebody came to you and they had more than one, maybe they had a heart issue, but they also have cancer and they maybe have something else going on, the concern there is how the nutritional portion is applied to that person, not how light therapy or vibrational therapy is applied to that person. Is that correct?
That's exactly correct. So
Okay.
in my point of view, the cancer trumps the cardiac issue. There's other things you could do for a person's heart and to help clear blood vessels and things that aren't going to increase VEGF production with a cardiac patient, that you won't hurt their issue with the cancer, with a solid tumor. And cancer always trumps any other thing, any other comorbidity that they have going on. So I would still treat it in that way. I would still not use nitric oxide supplements and other things that stimulate.
Okay, that brings up a question, and I want to address it because I know this is, if people listening to this are going to go, wait a minute, I thought releasing your nitric oxide is a good thing, and that's what light therapy does, and that's why the use of infrared light therapy has become so popular. So can you explain that a little more?
So really, if you are not stimulating nitric oxide production using light therapy, that's really not what's taking place with light therapy. You don't want to increase new nitric oxide to a person's system if they have a solid tumor. Now, again, there may be nutritionists that disagree with me. I just think it's wrong to increase VEGF production with somebody who has a solid tumor. You're going to increase the vascularization of that tumor and thereby have a possibility. It's not always going to happen, but you have a possibility of the tumor expanding and growing because of that. So that's the general rule of thought with cancer. You don't increase the vascularization of new blood vessel growth in a solid tumor. Now, again, none of this applies to leukemia, but it applies to anybody with a solid tumor.
Okay, and so light therapy, use of infrared light, releasing nitric oxide is different than adding new nitric oxide into the system.
That's correct. Yeah, you're not increasing the vascularization, the new growth of vessels in the tumor.
Thank you. That's very helpful to clarify on that. And so when we're using vibrational therapy or tools like your Rife or the Visum light, I would love to talk about how we can help people by using the Visum light in this entire process.
Well, I'm a huge fan, if anybody's read any of my stuff, about light therapy, because that's how really I got started in this pathway of seeing, my first patient that had a cancer diagnosis was my history of doing some studying on light therapy, and then a cancer patient came into my office, and I thought, oh my gosh, this is going to be perfect. We purchased a Rife machine for her, started doing it. She was given 3 months to live. She lived another 12, 13 years. So it works. It's not a magic wand. It doesn't heal everybody's sickness, but it is another tool. And just like any tool, like nutrition is a tool. Your spiritual attitude, emotional attitude is a tool. Changing your lifestyle as far as diet is a tool. Changing your lifestyle as far as chemical exposure is a tool. Standards of care and chemotherapy and radiation and surgery are tools. So you want to use them properly, and you want to, use them in combination, because the more tools that you use that are going to work on different facets of your health, the better outcome. It just makes sense. The better outcome you have. So it's just, you hear people that are like, oh, I don't want to do any alternative care. I'm just going to do what my oncologist says. Well, they may or may not have good results. But there's people on the other side of the spectrum that are, I don't want to do anything with an oncologist. I'm just going to do alternative. I think there's wisdom in combining as many things as you can wisely. It's not always wise to do chemotherapy. It's not always wise to not do chemotherapy. But you don't do something just because you think that's your only option. I think that's why I created the course. That's why I wrote the book, because I think knowledge is powerful when it's properly applied. So you have to have that knowledge then to properly apply any of it. So you have to gain knowledge and be willing to do the work to learn about how to best take care of yourself and your family members, so that you can pray about how to apply that knowledge. I think the application of that knowledge really is wisdom. So when we put our lives in the hands of a doctor, whether it be an alternative doctor or a standard doctor, and just say, well, just you cure me, you heal me, you do everything that you're supposed to do. I think there's danger in that. I think you're handing over some of that personal responsibility that I think we're supposed to have and carried for ourselves.
It's a scary time for people. Absolutely. The unknowns. I do know a person, close to me, and it's very frustrating because the doctors don't agree. So she's getting, different information from different people. How do you know which way to go? How do you know the right way to pursue? It's a scary time, and anxiety is really, really high, which is why the green light in here on the anxiety setting is a really helpful tool for people while they are trying to sort through this process. If your body's not in a parasympathetic state, rest and digest, and instead it's in the fight or flight state, you can't heal. Your body is so tight and so in that fight mode that you can't heal. So keeping yourself in parasympathetic mode is so important through the whole entire process. And I know that's a big task to ask of people, but it's really, really important.
Well, you're touching on something there that's really, I think, the most overlooked piece of the puzzle with not just cancer, but with any chronic disorder. Nutritionists are looking at, the nutrition and the diet and supplements and such. And I think that's important. We have to do that. But that's really chemistry, right? That's body chemistry. You're changing chemistry. The oncologist or the standard medical doctor is giving drugs, chemotherapy, or radiation. That's really altering chemistry again. It's so easy to overlook the neurology. So the neurology of everything that's what actually produces your own chemistry. Is you have to have a nerve input to that cell in order to produce digestive enzymes for the pancreas, or to produce HCl for the stomach, etc. Every cell has a neuronal input to it. And when we're talking about healing and your from your immune system to your detoxification pathways to dealing with your emotions and anxiety and balancing neurotransmitters, the part of the immune system that does that is what you touched on, the autonomic nervous system. And the autonomic nervous system, as you're starting to say, is separated into two parts, the sympathetics and the parasympathetics. Now, these are happening without you thinking about them. You don't have to think about heartbeat, stomach, digest, liver. You don't have to know any of the physiology. This is taking place on an unconscious level. And we do live in a sympathetic overdrive world. Our parasympathetics are suppressed. Our sympathetics are overdrive. Now you're going to stimulate much more glutamate production, which is going to stimulate anxiety and an inability to think clearly. Your sympathetics are your fight or flight or freeze mechanism. You're going to have a lot of freeze going on when you hear that you have a cancer serious diagnosis, and it's going to be difficult to think and remember and to process things. You have to stimulate your parasympathetics to calm that down. You can take some adaptogens to help with balancing that. You can do some things to change the chemistry of your sympathetics and parasympathetics, but the best thing to do is to do some parasympathetic exercises, and using light is so important.
And so quick and easy, my personal favorite is to put blue and green on together, which gives turquoise to the eye. And when I think about turquoise, I kind of think about sitting on a chair on the beach, with the waves blowing on me. And I'm talking about it, and I'm going into parasympathetic state. Look at what is happening with my nose. I'm fighting back a yawn right now, and I don't even have the light on. That's how powerful that can be, because I've done it so much. It's sort of a Pavlov's dog theory. My body's like, oh, I know what's coming. Okay, I start salivating.
And that's how quick the autonomics function as well, just what you just mentioned. And everybody can attest to it, as if you're driving your car and you hear a siren behind you, you instantly, your blood pressure jumps up 10 points, and you instantly get that little scared feeling. That's how fast your nervous system works. And we can get stuck in that fear mechanism, and anything you can do to calm down the sympathetics and stimulate the parasympathetics is so powerful to your healing. I mean, we could talk for literally an hour. The chemistry effects of the parasympathetics. Parasympathetics control your immune response. That is what controls B cell and T cell response, are your parasympathetics. If your parasympathetics are in the dumps, you're not going to be able to fight a serious disease. You're going to have a decreased white blood cell count. Your parasympathetics control your detoxification pathways. They control your gut motility issues. So you're not going to be detoxing. You're not going to be creating good enzymes by your liver phase 1 and phase 2 and phase 3 detox pathways if you're stuck in a sympathetic overdrive. So this is so important.
It is. And you just touched on the detoxing, and that is also important. And I know you talk about this in your course, which is a phenomenal course. I really encourage people that are in this process to get involved in this course. But you talk about how detoxing isn't a one and done. I mean, we can't go through a little detox program. We need to be detoxing every day. This is a lifelong thing, and we do it in our diet. We do it however we want to do it. But if it's part of our daily routine, then it doesn't feel so much like a detox. It's more of just part of our wellness routine. And you don't need to go through a big detox period. Is that correct then?
Right. I'm not a big fan of the box detox things, because you need to be supporting your detox pathways all the time. It doesn't mean you need to be taking a bunch of supplements, but you need to be understanding how those pathways work, and you need to be supporting those issues that, the phases of detox that you might have personal issues with. And as you understand those phases of detox, then you might go, oh yeah, I have really bad gallbladder issues. I really need to support that one. Or yeah, I'm constipated a lot. I need to figure out how to fix that and support that, or what it is that your personal issues are. Because if you're not getting out what is on the inside, you are becoming toxic, and
Absolutely.
that is, yeah,
Absolutely. And so that's so, so important to keep the body, and the digestive and the microbiome and all of that moving in a right way. And that's really something that isn't even in a lot of people's mind. What goes in comes out, and some of it stays stuck. And so how can we help them with that? Well, one way with the light is we use the yellow, and that's the combination of red and green, and then the eye sees the yellow. That's the beauty of this light, when we can start combining these colors. And then we put it on our belly button. And that belly button, and just hold it there, just sit it there for 10 minutes. How easy can it be while you're talking to somebody or watching TV or doing anything else? Put the light on your belly button for 10 minutes. I would pick one of the Nogier frequencies that we have a chart that we offer people. That one, cellular health and vitality, is the first thing that comes to my mind, which is frequency A. So you can pick that. You've got all of those different frequencies in this light, and the color combinations in the light to help support your immune system, your detoxification, and your parasympathetic. And that's all just on the front end. But if you're going through it and you wind up with uh, side effects from chemotherapy, or you got bruising and you got pain from the injections and different things like that, the light can help with that too. So between the course and the light, you've got a great package of support, and we're here to help. It's not a pleasant time for anybody, there's no doubt.
but I like one thing you touched on is the ease, because I know that people don't follow through with something that's complicated and difficult and life disrupting, the more life disrupting it is. So if it's easy to use and easy to apply, the chances that the person is going to use it is, it's going to be a much higher percentage. And you see the results, that's the beauty. When you start to see the results and you start to feel better, and you notice your bowel movements are better, you notice your gut feels better, your inflammation is down, your pain is down.
Your
That's,
energy is up a
yep,
little bit, you're not feeling like you got to take that nap every afternoon. And the other thing is, I'm available for a free 30-minute consultation with anybody that gets a light, whether you get it from us or from the Connor Clinic, wherever you get that light, you let us know, and we are here to help you. So we get you started off right. That's the best way to get you going. Um, we want you to use the light. The only time it doesn't work if it's sitting over there on the shelf,
right, right. Well, I thank you for everything you're doing. It's such a blessing to so many people.
Well, I appreciate that. And I appreciate, our partnership, and I'm looking forward to supporting the course and getting that in more people's hands as well, because it's really important that people know that they've got support and they've got resources that are unbiased, and they're not coming at them from one way or another. It's just like, here's information, use it.
Right.
Information's power, like you said, knowledge is power. So thank you again. I really, really appreciate it.
Absolutely. Thanks for having me on.